Examination of the hips, balls and sockets. Whoa, Margaret, are you late for your clinical skills session? Well, you're lucky your hips are healthy enough to let you rush up these stairs. Get yourself to the lab post-haste. For today, we are going to explain examination of the hips, balls and sockets.
After washing your hands and gaining consent, state you would adequately expose the patient's hip.
Gait.
Ask the patient to ambulate and observe their gait. The Trendelenburg gait can be caused by weak hip abductors, hip pain, or a subluxed/dislocated hip.
Inspection.
Observe both hips from all sides of the patient. Look for deformity, muscle wasting, scars, and skin changes. Now, perform Trendelenburg's test, Margaret. Reassure your patient that you will support them, then ask them to lift each leg in turn. Always recall that in a positive test, the sound side sags. So, which hip is abnormal here, Margaret? That's right, the left.
Palpation.
Ask the patient to lie down. Observe for any difficulty and for any walking sticks. Offer to measure both true and apparent leg length and to compare quadriceps muscle bulk. Now, ask about pain again, and feel with the dorsum of your hand for temperature, and palpate the greater trochanter for tenderness.
Move. If there is no pain, ask the patient to bend their hips to test active hip flexion. Now warn them you would like to push it yourself to see if it will move any further. This tests passive flexion. Note the angle reached in each limb. Normal range of movement for a hip is around 135 degrees. One can now perform Thomas tests for fixed flexion deformity of the hip, which can be masked by lumbar lordosis. To remove this mirage, place a hand under the patient's back and ask them to flex each hip again. Observe whether the knee of the unflexed limb levitates off the couch. So, one may move on to test a abduction and a deduction. Fix the patient's pelvis with your hand, and, if possible, by dropping their other leg over the side of the couch. Now, ask them to swing a straight leg out to the side. Then, ascertaining if it can be moved further by passive movement. Then repeat for a deduction. Normal abduction reaches 45 degrees. Normal adduction reaches 30 degrees. Terrific, Margaret! The final movements to test are of hip rotation. Warn the patient you are about to rotate their leg and test external rotation by moving the ankle medially. Then move the ankle laterally to test internal rotation. Having trouble remembering that, Margaret? Ha ha ha! Fret not. Many students do. Just remember that whatever you're testing is opposite to the way you move the ankle. Thus, external rotation is moving the ankle inwards, and internal rotation is moving the ankle outwards. After thanking the patient and offering to help them dress, state you would examine the joints above and below the hip and perform neurovascular examinations of both limbs. Then, present your findings concisely, Margaret. So, for healthy hips, Mr. Chief is comfortable at rest, has a normal gait with no signs of hip disease on inspection or palpation. Hip ranges of movement are flexion of 135 degrees, abduction 45 degrees, adduction 30 degrees, external rotation 45 degrees, and internal rotation 30 degrees, all bilaterally. Magnificent testing, Margaret. It shan't be long before you climb to the top. Now that you've mastered examination of the hips, balls and sockets.